Okay, I think we'll make a start, so we'll let other people join as they come in. But thank you and welcome for joining us today. This is our 5th webinar in our series of Children's Rights thematic webinars. My name's Anna Westall. I work for Children in Wales as a policy officer, and I'm going to be chairing this morning's webinar. We've just got a few basic housekeeping things to share with you before we start. So if we could just move to the next slide, Sally, I'll just go through some of the housekeeping. Thank you. So as you will already be aware, your camera and microphone are not active because of the webinar. This doesn't mean we don't want you to take part. We have got the chat function open. So the format for today is we'll have 2 presentations and then we'll have a question and answer session at the end. So please use the chat function to put any questions that you may have, and I will come back to these at the end. If we keep the chat function just for questions, just makes it easier for me then to review them as we're going through. The event itself is going to be recorded and it will be available on our website shortly after today. And we'll also circulate a copy of all the slides for you to have as reference. As part of our second presentation today, we are going to do an interactive poll. We'll be using a QR code for this. So if you've got a mobile phone, keep it handy for the second presentation, but we'll also provide the link in the chat for those that don't. So today's webinar, as you saw earlier, is entitled Crisis After Crisis, the Impact on Babies, Young Children and Families. I think the title speaks for itself, but as many of you know, families are really struggling and the services that are supporting them are at crisis point. We're dealing and coping with the aftermath of the pandemic, and now we're into the cost of living crisis and families are really struggling. Now, we're going to be focusing on child poverty, and child poverty levels have been high in Wales for a number of years before the pandemic and before the cost of living crisis. But now a growing number of families are really struggling. They're struggling to meet basic needs for shelter, survival and development. So we're focusing today on babies, young children and their families, and looking at how they're particularly vulnerable to the impacts of poverty. Our first speaker for today is Sally Hogg, who is the co-author of the Casting Long Shadows report, which highlights specifically the ongoing impact of the pandemic on babies, their families and the services that support them. So I'm going to hand over to Sally. We look forward to hearing your presentation. Thank you.
Thanks, Anna. It's great to be with you all today. So my name is Sally Hogg. I am currently Senior Policy Fellow at the Peddle Centre, which is the Centre for Research in Play and Education, Development and Learning at the University of Cambridge. But the work I'm going to be talking to you today is work that I started in my last job, where I was Deputy Chief Exec at the Parent Infant Foundation. And then I also, because I was kind of so involved and passionate about it, continued it sort of on a freelance basis as well. So I'm going to talk to you about a series of research that we did around the impact of the pandemic on babies, their families and the services that work with them. And this just very powerful picture is from the Hold Still exhibition, which the Princess of Wales pulled together over the pandemic, just showing in reality that kind of real tangible impact that the pandemic had on the lives of babies and their families. We were really conscious when the pandemic started that there was what we called a baby blind spot in the thinking about the pandemic, and particularly about the lockdown and lockdown responses, that the kind of acute care of people with coronavirus was the kind of top priority. Then people were thinking about the impact of the lockdown on kind of particularly the education system and children in schools, but no one was really thinking about the impact it was having on babies and their families. And as charities working in that space, we knew what that impact was. We were hearing about it all the time, and we knew how important the earliest years of life were for child development. So we were really concerned about what was happening for families. So we started research almost straight away in lockdown 1 to try and capture and amplify the impact of the pandemic on babies and their families, and then that evolved. So these are the first 3 research pieces that we did on this slide. Babies in Lockdown was a survey of expectant and new parents, which we did in the just at the end of the first lockdown, and it was published in August 2020. It really showed that the pandemic was having an impact, largely through the mechanism of impacting on parental stress and mental health, which then had knock-on impacts, but also through families not being able to access both formal and informal forms of care. And in that report, we also started to really show the unequal impact of the pandemic. At that point, there was very much this kind of blitz spirit, we're all in it together narrative. And what we were showing was that we really weren't all having the same experience. And I use this analogy that we were all in the same storm, but we were in very different boats, that families that went into the pandemic already experiencing poverty, stress, domestic violence, mental health problems, young families, were much more likely to be having a very difficult time through the pandemic. So we were really concerned then about the pandemic exacerbating inequalities, and sadly all of the data we've seen since shows that that came true. The good thing about working in charities doing this research is that we were doing it very live and feeding it into government all the time. And it did start to have some impact, not as much as we would have liked, but we started to see, for example, in the second lockdown, some of the rules around babies not being counted in one-to-one rules, so mums could get out and see each other, some support groups for parents being able to continue. We noticed that local areas and different regions of the UK were responding very differently. So in some places, there was kind of that baby blind spot was exacerbated by local decisions. Health visitors were redeployed, services were stopped. In other places, there's this real mobilisation of services for families, an amazing kind of innovative partnership working between the voluntary sector and statutory services to ensure that babies and their families got support. So the two Working for Babies reports that we did here really looked at that kind of how the system and services were responding to this, and what made a difference, how some local areas were able to provide this amazing support for families and what we might learn from that. I'm just going to pause and say I can't see or hear anybody. So if there's any issues in my slides, don't just let me kind of talk on with something wrong. Do please like unmute yourself and tell me what's going on. I can't see the chat either, so it's quite disconcerting. But anyway, I'll carry on. We then did this Babies in Lockdown 2 report, which was done in October of 2021. So this was kind of, we'd had lockdown 2, we were coming out of it, there was all this chat about building back better. We were still pre-Omicron, so we kind of really thought we were getting out of things there. But we were really conscious that there was this ongoing impact, this kind of accumulative adversity for families where they'd maybe had pregnancy, being concerned about the virus, they'd given birth without the full support around them, they then got home and not be able to see their families. And kind of this was a year on from that first lockdown, and these families had faced kind of issue after issue after issue. It wasn't just that they'd had like a 3-month stressful lockdown, that the pandemic was really having this long-term impact on families. So we wanted to capture that. And we were also really clear that services were not coming back properly, to the extent we weren't seeing this kind of, we'd been promised building back better. We weren't even seeing building back to normal. It was kind of definitely getting worse. So we were seeing that more services were moving to being remote, particularly kind of health visiting contacts, that some services were just not coming back at all, particularly kind of things like health visitor drop-in clinics and voluntary and grassroots provision like baby and toddler groups were struggling to come back. And also when services were kind of coming back, they were coming back in different ways, and that was having a real impact. So families told us, for example, that if they were getting a health visitor contact, and many still weren't, it just didn't work for them in many cases to have a virtual or remote thing, particularly if they had concerns about their children. So the title of this report, No One Wants to See My Baby, is based on this quote from a mum saying, you know, I just want somebody to lay eyes on my child and reassure me they're okay. You know, it doesn't work for me. I don't get reassurance by having these phone calls. I want someone to see my baby and talk to me about this baby. And we were also seeing that when services were moving to things like from what previously had been drop-ins to kind of scheduled services that parents had to book places at, often that really made it more difficult for the most vulnerable families to engage. So just, you know, thinking about baby and toddler groups, the sort of really grassroots things in local church halls, they were often something that families could get to, even if they'd had a really bad week and things were quite chaotic. If you had a good morning, you could get your baby and toddler out, you could get yourself dressed and you could get down there, and there wasn't a fixed start time, so you could sort of turn it when you could, and that was really welcome for families that were struggling. And actually, if it went to a position where you had to book your place in that group a week in advance, families just weren't bothering, or they weren't confident enough they were going to be in a place to get there, so they were really missing out. So casting long shadows then came another kind of 8 months after that. So this was done, the research was done in the summer of last year, and we published the report in November, really to carry on that story of what was the ongoing impact of the pandemic on babies and their families and on the services that work for them. And the report had kind of 3 sections, which are these 3 boxes across the top of the slide. So children's experiences, children's outcomes, and the state of services. And we repeated a lot of the questions in the survey that we did for this. So we did a survey and a literature review. And we repeated a lot of questions in the survey of professionals that we'd done in our previous research. It wasn't really robust research in that we weren't using exactly the same sample of professionals. So it's, we were sending it out through the same kind of online channels and getting kind of similar demographics of professionals responding, but not exactly the same. So we I do in these slides compare what professionals told us in the different surveys, but it wasn't exactly the same group. In terms of, just to give you a bit of kind of geographical context, this survey was professionals right the way across the UK. We did break it down by the different nations, so we know that Wales was represented kind of proportionately in the respondents, and we didn't see any particularly different messages come out from the different nations of the UK. So the stories that I'm telling here, the facts, the stats, the quotes are UK wide, but we have reason to believe from what we saw that they are representative of what's happening in Wales as much as they are of any other bits of the UK. So what did it tell us about children's experiences? The first story, because we'd had this huge theme through all of our research that one of the biggest mechanisms by which the pandemic was affecting children was through, very, very little children, babies and young children, was through its impact on parents and their mental health and their stress. And the literature is telling us that our kind of collective mental health as a nation has not gone back up to pre-pandemic levels, but it is better than it was at those worst bits of lockdown. And the survey suggested the same thing. So 40% of our respondents, of the professionals, told us that many of the babies they worked with were still being affected by parental anxiety, stress and depression that they were judging was affecting the relationship with the baby. So still very significant numbers, but quite a big drop from during the lockdown. But we really saw this story of this accumulated adversity and accumulative stress, which I spoke about before, that families had kind of faced all of these different phases of the pandemic, and it meant different things that they were missing out of through pregnancy, birth, and when their babies were little. And then the kind of cost of living crisis was starting to sort of hit last summer. And there was a real concern that families, having gone through all of that adversity and stress, didn't have kind of resilience to face yet another challenge. So it's going to have even more impact on them. And here's a couple of kind of quotes that bring that to life. I'm not going to read them out in detail, but just that idea that actually people have had all this kind of accumulated stress over time, particularly our most vulnerable families, and that's going to be further compounded by some of the ongoing cost of living crisis, which we'll talk about later in this event. We warned in the first lockdown that babies were more likely to suffer maltreatment if they were in families where there was this kind of pressure cooker of stress, and also where there were no professionals with eyes on the baby and no supportive family members who could maybe give parents a bit of a break. And sadly, we have seen that come true. There was an increase once we started to get eyes on children again. We saw an increase in reports of maltreatment and a number of serious case reviews that brought out that dual risk of increased stress in families and less professional support. And interestingly, in this survey, more respondents, so 40% of respondents said many babies were currently being affected by increased exposure to abuse in the house, so either domestic abuse between family members or child abuse and neglect. And that was higher than what we saw in the first reports that we did in 2020. So it feels like actually that accumulated stress is putting more pressure on families. But of course, with many children still not being seen face to face in those very early years of life, we're still worried about children who, for whom kind of maltreatment is going undetected. There were many ways in which children's kind of experiences of play and positive activities were affected during the pandemic. They weren't able to access early learning settings for many children. Playgrounds were closed in the first lockdown. Playgroups were closed for a very long time in many places. And parents had varying ability to be able to interact with their children. We did hear some lovely stories about families being at home and able to interact, but also places where actually the stress on families or parents needing to juggle work without childcare meant that children had less time for play. And in our survey, professionals were saying that nearly half of professionals said that many babies they work with were impacted by more sedentary behaviour and less stimulation and play than they would have expected compared to babies before the pandemic. And that is a similar number to during lockdown. So even though all of the kind of pandemic restrictions have lifted and we should be back to a more normal, the same number of professionals are saying children aren't getting these play and positive opportunities. There's some really interesting stuff came out around smaller social networks, and I think this is really important in the perinatal period. I definitely remember my experience of the perinatal period was forming this kind of the village, my little group of kind of mums and their partners who I met through antenatal education, who I saw at mum and baby groups, and who I still, even though my kids are now 6 and 8, can rely on when stuff goes wrong, both practically and emotionally. And obviously during the pandemic, families didn't have that chance to create their kind of networks, and that led to increased loneliness. It led to increased isolation, and then to kind of knock-on effects. And one of the interesting knock-on effects we found in the research was this American research that suggested that one of the reasons we're seeing poorer language skills in the toddlers and preschoolers who were babies in the pandemic was because they weren't being exposed to those kind of adult conversations which would normally be taking place around the child. And there were lots of things that came out in the kind of qualitative parts of our surveys about the impact of this lack of kind of social mixing for parents, in terms of their mental health, in terms of their confidence in their parenting ability, in terms of their ability to understand normal child development, and therefore either think about what they could be supporting their child to do and to develop, or actually identifying if their child perhaps wasn't developing as they should and seeking support with that. We're going to talk about this more later, but clearly we were already seeing rises in poverty in the UK prior to the pandemic. The pandemic led to financial pressures on families, and then we're seeing the cost of living crisis and more poverty, and our professionals were reporting that that was continuing for families as well. So that's children's experiences. As I said, it's a very unequal picture. We know that some children are kind of having a kind of back to normal type experiences. Some families are benefiting from increased flexibility in home working, but we're really concerned about the increased number of children who are not having the experiences they need to support normal development. And we warned in March 2020 that this was going to have this knock-on impact on children's development, and we're now seeing that in terms of both national data and academic research showing that children who are the babies and the young children in the pandemic are not developing to levels across the population that we would expect compared to pre-pandemic levels. So we're seeing increased prevalence, and this is looking at national data, so things like health visiting review data. It's looking at academic research, and it's also looking at what our professionals were telling us, and they were incredibly consistent. So more speech and language delays, more social health and emotional needs, and some impacts on physical development as well, and physical health, so increased obesity. But the two big things that were coming out were social and emotional development, the ability to socialise, the ability to regulate behaviour, and language skills. And we asked professionals about whether the pandemic was having a negative ongoing impact on children's development, and most professionals said that for babies who were born in the pandemic, it was having an ongoing negative or very negative impact on their wellbeing and development. So you can see here 92% of professionals said it was having an ongoing negative development on negative impact on communication skills, 94% on personal and social skills. The dark blue bars here, we asked about babies who've been born since the pandemic. And professionals are telling us that they're worried that these babies are also falling behind expected levels of development because the pandemic, the ripple effects of the pandemic on social networks, on services hasn't gone away. And so even though these babies weren't born in lockdown, have been born since the kind of official national measures to control the pandemic have gone, they are still being affected. And there were kind of lots of quotes that talked about what people were seeing. And really clear that idea of exacerbating inequalities, which I've talked about a lot now, that children who were born into families facing more disadvantage, particularly poor housing, poverty, parental mental health problems, had a worse time during the pandemic and are struggling to catch up. And there was yet more research out this week from the National Audit Office showing that all our children are, across all sectors of society, we're seeing some impacts of the pandemic, but the gap is widening. Disadvantaged children are showing more impacts, and so we're seeing more inequality in society. And so finally, the state of services. We know that many services haven't gone back to normal, and in some cases that's positive, but in many cases it's perhaps not kind of planned positive changes to services. So over half of our professionals said that services are not back to normal. So 64% said they're either a long way off or not quite back to normal. And interestingly, 60% said these changes are not beneficial to families. It was a very varied picture. So we saw that, for example, GPs and health visitors are doing more online work. Other services are getting slightly more back to face-to-face. And within health visiting services, we're really seeing this thing where a lot of places are saying actually the drop-in aspects of what health visitors used to do are not coming back, or not coming back to the same extent. So some of the checks might be returning, but some of that more kind of outreach work isn't available. There's been some benefits of hybrid working in particular. So this is not a kind of whole-scale change to remote working, but we're actually seeing a hybrid where particularly we heard benefits where both professionals and parents are able to choose a mix of either online and remote services or face-to-face services to meet their needs. And particularly for particular kind of issues or groups of women. So this kind of example here of pregnant women who haven't finished work yet preferring video contact. The fact that actually if there's breastfeeding support online, you don't need to get out of your pajamas and you can access it every day of the week. So there's definitely some benefits of hybrid working, and some other sorts of innovation too, particularly around kind of more creative ways of working, more outdoor service delivery, more flexibility in the way that services are offered. This kind of mention of more outdoor working and walk and talk type offers came up quite a lot, and people seem to be really enjoying that sort of method of service delivery. And staff prefer, in some cases, remote and virtual working for professional to professional contact. So it enables them to access more training. It stops, if you work across a huge county, everybody having to schlep, an hour in their car to County Hall for interagency meetings, because you can do that sort of stuff online. So there's definitely some benefits for professionals, but it also brings risks for families, and this is really important. It brings risks in terms of reduced contact with children, reduced quality of assessment of what's going on for families, reduced ability to pick up all of those cues in families and houses that tell us about safeguarding risks. It risks exacerbating disadvantage because of the digital divide. And not all of the changes may be popular or helpful for families. So actually there's a kind of real concern that whilst some contacts might be happening, they're not happening to the same quality that they used to be, and that also being a disadvantage for professional morale. So we heard a lot of quotes like this one, I've been a health visitor for 23 years and the service is not what it used to be, and actually it's not as rewarding, and we're more concerned. And children are not getting the help they need. And UNICEF did some polling this was in England, but with more parents saying actually they're struggling to get the support their families need. And we heard that in two ways, about fewer issues, developmental delays and needs being picked up because families aren't having the contact with professionals, or that contact isn't of that quality that enables issues to be detected. And then even if issues are detected, there are more struggles to get the support that families need to deal with any problems because of the huge backlog in services. So there's a couple of good quotes here around things being missed. So how it's harder to understand what's going on in telephone contact, this nice bit around, you know, no one likes to admit their child is doing wrong. If you're just asking a parent, you're not going to get the same breadth of information that you would notice if you saw the child yourself as a health visitor. And also actually not persisting in chasing families that don't respond to reviews. There's been a lot of talk nationally about these invisible children who aren't attending school, and I think we really need to be talking much more about the invisible children who might turn up at school in 1 or 2 years' time, not having been seen since they were discharged from hospital, because I think some of those children do exist. And then, as I said, more referral delays as well. And finally, the workforce being really at breaking point. Pressures to deal with all of this huge need, this huge concern, added to staff being worn out after all of the work they've done in the last few years, all of the kind of workforce issues we're seeing across the UK around workforce shortages, insufficient pay, staff burnout, all of that having a huge impact that we need to be very concerned about. So to conclude, we know a lot about what happened in the pandemic. And actually there's more academic research coming out all of the time, which is on more of that kind of lag, that it's actually only being published now because it's gone through that academic process. But we've still got a lot to learn about some of the long-term impact the pandemic had and the mechanisms through which it happened. But we can't wait for some of that to play out. We need to be acting. We know that the best time to act is early. There are some interesting lessons about policy and practice in child development, which we can reflect on if we have the headspace to do it. And there are opportunities to learn from some of that to accelerate service development and innovation. But we mustn't allow things like remote learning to remote delivery of services to be adopted just because it's cheaper and feels easier in this time of kind of tight resources and stressed workforce, when actually it's going to mean that children's needs are being missed. So I hope that was useful. I could talk about this all day, but I'm going to stop now and I'm very open to questions.
Thank you, Sally. Yeah, it was lovely to hear it in some ways, but also not really hard to hear some of the, well, most of what was shared today. It's not nice, but it is the reality, and it's really important that we are aware of the situation. Although many people here, I'm sure, are aware of this, it's really good to see it in this report. We are going to take questions, but we'll take them at the end after we've had the next presentation. And there's some really interesting comments in the chat, so please have a look, Sally, just really sharing the concerns that have been raised in this report. Yeah, quite hard reading. What we're going to do now is we're going to move on to the second presentation. We've got Helen Wales, who's going to present on behalf of the Early Years Action Group, where we're going to focus a little bit more on the Welsh context. And we're going to think a little bit more about how we can kind of activate and support change and support these babies, families and young children, rather than focusing so much on what's gone wrong. We're going to start to think a little bit more about what we can do to support them. So over to you, Helen.
Hi, thank you, Anna, and thank you, Sally. That was such a rich presentation with some important but difficult things to hear. I'm just sharing my screen. Anna, have we got the presentation up there?
Yeah, all on there, fine.
And can you hear me clearly?
Yeah. Perfect.
Excellent, 2 down, great. So my name's Helen Wales, and I'm speaking on behalf of the Early Years Action Group today, but I'm just going to tell you a little bit about the work that I do at the moment so that you know who you're listening to. So I work for an organisation called Nesta, and Nesta is a social innovation agency. What that means in practice is that we're interested in finding new ways of addressing big challenges. And we're also interested in supporting others who are developing effective solutions and to help them take them further. So my work in Wales is to lead Nesta's Fairer Start mission. And through Fairer Start, we want every child to have an equal start in life, focusing on narrowing the outcome gap for children growing up in disadvantage. Nesta has a 10-year commitment to working on the early years, to working on equity and a fairer start in Wales, and to using a wide range of approaches and methods. So if you'd like to talk about our work, please feel free to get in touch with me separately. I'll put my email address in the chat after the presentation. But I'm here today to talk about the Early Years Action Group and our response to the cost of living crisis. So we were formed in 2020 to bring together third sector organisations who have a focus on the early years, and really importantly to establish a collective voice and to activate for positive change for the very youngest children. You'll see from the list of our members that we're a really wide-ranging group. We have different expertise and different interests, and we're really interested and keen as well in growing the group. So if you work for third sector organisation and you're interested in joining us, please contact Anna. If you work in the public sector or the private sector, we're also really happy to hear with you and talk about what we might do together. Dialogue across sectors is incredibly important to us as a group. So like lots of people in the autumn, it became obvious that the cost of living crisis was going to be really significant for children and families, particularly on top of the things that we'd been through together in the last couple of years with COVID. And we decided that we needed to put out a collective response to this crisis. We wanted to reflect and bring together what we were learning, especially focusing on the early years. And I'm going to share that with you today. So just a couple of stats for context. Sort of figures like this aren't always that easy to digest or take on, but I think it's really important that we remind ourselves of them and have them up our sleeves. So the first two are from a report by Loughborough University published last year for the End Child Poverty Coalition. 1 in 3 children in Wales is living in poverty. And actually in every local authority, more than 1/4 of children are now living below the poverty line. So even in local authorities that we might have previously assumed were more affluent, we're still seeing significant numbers of children living in poverty. This other point as well, Sally shared with us, of the 4.2 million children in poverty in the UK, 1.3 million are babies and children. So poverty is disproportionately affecting our youngest children, and that came from a report from the Institute of Health Visiting released just last month. So when we started to think about our response as the Early Years Action Group, this state of affairs was really driving us, and I'm sure it's one that you're all familiar with, but again, it's worth really reminding ourselves of. That poverty has a doubly negative effect on babies and young children. Access to opportunity is reduced through limited resources. And then on top of that, parental and family stress are increased as a result of living with the challenges of constrained income. I think interestingly, Sally has also highlighted a third factor here, which is also that babies and young children are also dealing with having had reduced professional services over the last few years, and that those services are still reduced. We're really deliberate and unapologetic in the Early Years Action Group about talking about babies and young children. We don't talk about babies often enough, and too often when we talk about children, attention can go to older children. The youngest and the most vulnerable can really easily be overlooked, as can those who work with them. And I think a case in point is that question that those working in social care during the pandemic were quite rightly given a bonus, a reward, but that didn't apply then to those who had been working in childcare. So of course we know that children's experiences in the first days, weeks and years significantly influence the rest of their lives. We know that healthy development depends on the quality and reliability of a young child's relationship with parents or carers. And we know that parenting is hard at the best of times, but dealing with the day-to-day impacts of poverty can really make things difficult. We also wanted to add, though, that we're not just talking about poverty and the cost of living. As Sally said, the cost of living is sort of part of an accumulation of stress and anxiety, not just following COVID, but we're also working against the backdrop of the ongoing climate emergency and other crises, including the war of Ukraine. So there is a period of uncertainty which may be new to lots of people. Our group also wanted to draw attention to the relationship between the crisis we're seeing now and children's rights. Children's rights are at risk when families face overwhelming pressures. Parents and carers are the key people who uphold children's rights in the home. And the group and others in Wales feel that what the United Nations Convention on the Rights of the Child tells us quite clearly is that government has a role in supporting parents and caregivers to uphold children's rights in the home. And supporting families facing poverty to uphold those rights is particularly important. We've just got a couple of other bits of information and data really from Wales. So this is some polling of 1,000 parents that Nesta did last August. These are parents in Wales. Parents were concerned about the cost of living over the next 12 months. 84% were concerned about paying for fuel. 72% were concerned about paying for food, and 66% were concerned about being able to pay for children's social activities. I want to add that out of all of those who are worried about paying for food, in all but the highest income groups, over 2/3 were worried, and we saw a similar pattern when we asked about gas and electricity. And I think this is important because we're talking a lot and very rightly about how the current crises are exacerbating inequalities. But what we're also seeing is more and more families being drawn into difficulties. Our polling also showed that 57% of parents in Wales were concerned about the long-term impact on their child's mental health. And then finally, for background, I think this quote is from the Children in Wales Poverty Survey last year. Practitioners stated that they were seeing a dramatic increase in the number of families that can't meet basic needs, such as the provision of food, electricity and clothing. And I'm just imagining that a lot of people on this webinar are nodding as they read this. There is not one family that I'm working with who have not said that they are now struggling. So what needs to happen? We don't just want to describe the problem as an action group. You know, we have that word action in our title. So we developed some calls. At the heart of our response were these 4 points. We need long-term thinking as well as short-term and crisis responses. When we're dealing with difficulties, it's really easy to focus on the immediate need, and we need to do that, but we also need to be able to look ahead to develop longer-term and more sustainable responses. In many ways, we have a policy environment in Wales that feels favourable. We have the UNCRC commitments, we have a commitment to the early years, we have big investment in programmes like Flying Start and Families First. But is it enough? Are we able to deliver what's needed, and is it enough now? Integration is really important. Working across services and sectors is something else that Sally picked up on in her presentation, that where things really worked during the pandemic, people worked together. And we know that when things are difficult, it's really easy for all of us to sort of retreat into our own activities and deal with what's needed in the very short term. And also now is the time for action. We can't wait till this crisis is over and think that we can address issues then. So we have a series of calls. The first one, and the one that it really sums up everything, is to prioritise babies and young children in the tough decisions ahead, including protecting services that support children, families and early intervention. And we are saying that when there are decisions to be made, and we know there will be tough decisions, the weight of the evidence tells us that babies and young children need to be prioritised. We also know that we risk an erosion of services. And again, Sally has talked to us about how digital is not necessarily a solution, and it has a lot of shortfalls. Ensure the right support at the right time for parents and parents-to-be, and that means a range of supports in ways that work for those families. We believe in investing in specialist parent-infant relationship services across Wales, and Sarah Whitcomb-Hayes in NSPCC Wales is really doing some excellent work on this. And then on a more focused short-term call, we're saying we really need to make sure campaigns aimed to support families living in poverty, for example, campaigns around increasing take-up of benefits and financial support, are targeted at families with babies and young children. We know that if we don't target, we miss people, and Save the Children are doing lots of important work in that area. We need to bring forward plans for an integrated early childhood education and care system. We know that quality early education and care can really make a difference for children's outcomes, particularly those growing up facing other difficulties. But we need to make sure we have equity of access to high quality care, and our partners in Culham are really leading the calls on this. We need a refreshed and revised child poverty strategy and delivery plan that responds to the challenges now. But we don't just need a plan. We need to be monitoring the impact of poverty on children's outcomes. And we also need to be really evaluating the interventions that we're putting in place and asking, are we doing the right things at the right time? And then finally, we need to make sure that we're listening to babies, young children and families to support decision making. So that's a run through our calls, and I think Anna's going to come back in now and explain what we're doing now, because this is where we have a poll, because we want to hear from you.
Yeah, thank you, Helen, for sharing that. Really important to start to think about what we can do to activate change. So we presented the earlier action group priority calls that we put forward, but we would really like to get your input on this. So what we've devised is a small poll using Mentimeter. So if you do have a phone handy, then please scan the QR code. Otherwise, I'm going to pop the link into the chat. And what we want you to do is the first question, just list the priority calls and actions that Helen has just summarised. We would like you to rank which ones you think are most important. I know it's a slightly difficult task to do, but just do your best to try and rank what you think is most, it needs to be prioritised first, and rank them using the poll. And then there's two further questions just to pull out a little bit more about your thinking about what else needs to be done, what is also impacting on babies and young children. So any problems, let us know in the chat, but please have a go at scanning the QR code. Like I said, it should take you straight to the presentation, the poll, and I will present it on the screen for you as well. I'll just pop the code and the link in the chat as well. You can see people are accessing it. If we pop down the QR code now, Helen, I'll share the screen. But yeah, don't feel you need to rush, have some time to read them and rank them, and you'll see on the screen, obviously, as people's answers are coming in. We'll move on to the next slide. You can continue ranking if you haven't. Don't feel any rush to make your decisions, but I'll just move on to the next slide. And people, you can see the answers people have popped in for the next question. This is the one, yeah. What are the main things impacting, in your experience, what are the main things impacting babies, young children and families at the moment? And as many of you know, as word clouds work, the biggest words are in there means the most people have actually typed them in as their response. And you can see clearly the two we've been talking about today, I think right in the middle of there. And we'll happily share these word clouds after, so you can view them in a bit more detail, because it's a little difficult to read as it's continually moving. And then the final question we put to you was what needs to be done to support babies, young children and families. Obviously, we shared with you some of the things that the early years action group put forward, but we're really keen to hear of other things that you felt really needed to be done to support them. Fantastic, loads of things there. You can continue to add to the word cloud if you haven't finished. I'll stop sharing the screen at the moment, but like I said, we will happily share the full word clouds with you after the event, so you can look more closely at them. I'm just conscious that we are coming near the end, and to give us a chance for some questions. So we welcome Sally back. Oh, there we go. Thank you, Sally. Thank you both again so much for sharing with us today. It's been really, really informative, upsetting at the same time, but I think ending on kind of what we can do to support has been really, really important.